Good morning. Welcome to Community Conversations. I'm Vicki Green. It's Breast Cancer Awareness Month, which after meeting today's guests, I feel should be every month. And my guests live this issue every day. And we're here to talk about what's behind the pink bow or the pink ribbon. So we have a remarkable, inspirational local two-time breast cancer survivor, Ann McCarron, who is also happens to be the Associate Athletic Director at WPI. Good morning, Ann.
Good morning.
And along with Ann, we have a doctor who's in the lab trying hard to help fight this beast of a disease. She's Dr. Caitlin Brown from UMass Medical School. Good morning.
Good morning.
And thank you, ladies. First, before we get into Ann's story and the amazing research that's being done, I just want to set the stage for people listening. And you're going to want to hear Ann's story. It's truly amazing. But first, some numbers from the American Cancer Society, just to put this in perspective. In 2017, which was their last data last year, 250,000 women, so 250,000 women in the U.S. were diagnosed, or were projecting to be diagnosed with breast cancer, and approximately 41,000 they expected to die last year. In Massachusetts, approximately 6,500 women were expected to be diagnosed last year, and 750 were going to die from the disease. So that same report notes that a woman living in the U.S. has a 1 in 8 chance of being diagnosed with breast cancer. So it's definitely being talked about much, much more, and I know Ann will get into that. However, the same data says that in 2016, 3.5 million women in the U.S. with a history of breast cancer were living. So I think that can be looked at in two ways, and it can be looked at in a positive way. There were 3.5 million women diagnosed, but they were living and they were alive. And that talks to what we're going to talk about the research and the medical medicines that are coming out, along with other treatments. So this is not meant to scare anyone. If nothing else, it's through survivor stories and research that gives us hope. So Ann, can you tell your story about how long ago you were diagnosed, and take us through the feelings of, if you can put yourself back in there, because you still live with it today. But when you first found out about it?
Well, my cancer journey started, sadly, in February of 2014. I will never forget that terrible afternoon when I was attending my son's science fair, and my doctor called at 6 o'clock that evening at the fair and suggested that I find a quiet place she could talk to me. She told me that I had breast cancer, and at that moment, I began my fight. I went to an oncologist right away, and reviewing all my breast cancer, they told me that I had what was called triple-negative breast cancer.
Now, had you had a mammogram, Ann?
You
went in for your regular mammogram?
Yeah, a mammogram diagnosed after an ultrasound and biopsy. And then she called me at the science fair and said that I definitely had breast cancer. And then I discovered the type of breast cancer I had was triple-negative breast cancer. And, of course, when I heard triple-negative, I had 2 thumbs up. Good, right? What I discovered and learned that triple-negative is a rare and the most aggressive form of the disease, affecting only about 15% of breast cancer patients.
Wow.
I went through the mastectomy and rounds of chemo, and I lost my hair. And after I was restaged, I was told that I had stage 1 triple-negative breast cancer, and, again, I was okay.
What does restage mean?
Just that after they did the mastectomy, they, looked at the tissue
again,
and, staged, I didn't have anything in my lymph nodes, and so I thought...
It didn't spread at that point.
Didn't spread, and I had the best outcome possible. So I was really, excited as far as I couldn't ask for a better outcome at being a triple-negative breast cancer survivor. And, I did. I had my treatment, and I was going on with my life and went back to work. And actually, I never left work, but I was continuing my job and felt good. And then it was just, going to my oncologist every 6 months, check off unless something felt wrong.
And this was 4 years ago?
Yep, that was 4 years, 2014.
Okay, so how did you approach your son about it? How old was your son at the time? Because I'm sure with any kind of cancer, people listening I think cancer in some form has touched almost everybody in the United States. So people have difficulty explaining things to their children. How did you take that?
You know, I didn't want to hide anything from him. I wanted to let him reassure that I'm going to be okay. And we did talk to him. We sat him down. We cried.
And how old was he?
He was in 8th grade, so
Okay.
about 15 years old, 14, 15 years old. So, you know, he knew everything that I was going through and knew when I was going to for treatment, and, you know, he was part of that process. But also letting his teachers know, making sure that he was well taken care of. And, you know, I worried about him emotionally, but we communicated.
And I think that's probably very, very important. When we're going to go on in a minute, but Anne, Caitlin, Dr. Brown, can you explain what metastatic, meaning metastasized cancer is, and what's stage triple negative? Because as Anne said, it sounds like a positive when you say something, no pun intended, but it sounds like a better thing when you say it's something with a negative.
Right. So metastatic disease just means that you have a primary tumor. So for breast cancer, it would be in the breast. Metastatic disease means that cells have broken off from that primary tumor. They have traveled to somewhere else, like a lymph node or, you know, the bones or the lungs, and they have set up shop in those other organs and have started to grow in those other places. That's what a metastasis is.
And so that's what you're doing. You're doing research at UMass. You're on a 2-year project right now, funded by the American Cancer Society. And you're looking at how it travels or why it travels? Is that...
Yeah, so my work studies on how cancer cells survive the trip from the primary tumor to the metastatic site. So it's very difficult. Only 0.1% of cells that leave the primary tumor actually make it to set up a metastatic site. So
meaning that's a good thing? Meaning most of them don't travel?
Most of them don't survive very well. Okay. But I want to know why those cells survive. How do they survive? What changes do they have to make that trip?
So that it can be stopped.
So that we can stop it. We can halt those cells in their track and keep them at primary tumors.
Okay,
That
wow.
would be good.
And you told me before the show that you had a personal interest. I mean, were touched by this yourself.
Yes, I do have a family history of breast cancer, so there's sort of a selfish aspect
Well, I wouldn't
to the
call it
research.
selfish.
Yeah.
I think it's it's very selfless to do something so important. But you always wanted to go into cancer research.
Cancer has been a driving force in my interest in biology. Yes. Yes.
Okay. And are we moving in the right direction? It's specifically in your area of research?
Yes, I think we are. Certainly with the development of immuno-oncology fields.
Which means cancer drugs?
Cancer drugs, using the immune system to attack and destroy cancer cells. That has been a major step forward for patients. They're driving cancer at least into remission, making a chronic disease, not a death sentence, and also hopefully a cure. An actual cure
we hope.
for breast cancer.
Okay, so back to Anne. Okay, I read about you in 2016, and I saw pictures with Tom Brady and Gronk. And I know that Myra Kraft, and a lot of people that live in the area may know, she's from Worcester, and she passed away, Bob Kraft, the owner of the Patriots. His wife passed away in 2011 from ovarian cancer. So now he's a very philanthropic guy anyway. But being that his wife was from Worcester, being that she had cancer, there was something that they did when they reached out in 2016, the Patriots. So why don't you tell us about that?
So I was, again, blessed that the American Cancer Society nominated me as a breast cancer patient going through it at the time, all the treatment. They nominated me to go with the Patriots for a day of pampering.
A day of pampering.
Yes.
Right. So I read that you thought that meant like yoga and nails.
Yeah.
But no.
Yeah, and we went to a little paint session, painting and
art painting, right?
Art painting. So we also went down in the on the Gillette Stadium on the field, and while we were there taking pictures, and I had 12 other breast cancer survivors that were there with me that day. All of a sudden, coming through the tunnel was Tom Brady and Gronk, and they came and we had some nice pictures taken with them, and it happened to be the first week he was back after a suspension. So,
wow.
And then Bob Kraft invited us to the Patriots game that Sunday.
And you had never been to one?
No, I've never been to a Patriot game, and it was a great day.
I bet. And then you were talking about how at the end of it, you went out on the field and they made a a ribbon
Yeah, we did
made
the
a formation.
we did the pink ribbon before the game, right before the national anthem. So it was great. There were other survivors there and their support team, and God, I think there were over 300 people, and we formed this pink ribbon.
Now, did you have support with you?
Yeah, yeah.
Okay.
I did.
So we're going to back up for 1 second, because between 2014 and 2016, you received a second diagnosis.
Yeah, it was actually 2015.
So in the middle, yeah.
In December, I wasn't feeling well. I knew something was wrong. I went to my primary care, and I called my oncologist that had been monitoring me, and my primary care set me up for a CAT scan. And I went to a CAT scan that morning, and that afternoon I got the same phone call from the same doctor that my primary care that told me that I had metastatic breast cancer.
It had spread.
It had spread to my liver. And to get right to Dana-Farber to see your oncologist right away.
And what was the treatment for that at that time?
You know, we went through again. One thing that I did learn with the metastatic breast cancer and triple negative is that I was told that it was not curable but treatable, and those were hard words to hear. So we went through what the treatment was going to be, and it was chemotherapy. I was told for the rest of my life.
And just in case people aren't aware of what that means, it means going into Dana-Farber. You live out here in the Worcester County area, in Central Mass. Going into Dana-Farber, and
It was 2 weeks.
IV?
Yep. I actually have a power port.
Okay.
That was probably one of the best things I've ever done.
what's that?
It's a port that I have where they can put the
Internally?
IV. Yeah, put the IV right in, so I don't have to get the IV
Every time?
Every time. So it's a pretty simple procedure to have it, and I still have that, and I'll have that probably for the rest of my life. But that was, so, you know, when I was told that I would be on chemo for the rest of my life, we had a couple of options. We could do this chemo, and then there were some trial drugs out there, which I had to be screened for these trial drugs, and one of them was an immunotherapy drug. So I was on the immunotherapy drug and chemo at the same time for about 4 months, and I continued. I started to have the side effects with the immunotherapy drug, so we stopped that.
And what were some of the side effects? Because you had told me that before.
Just weakness. It did affect my adrenal gland, where I now don't produce my own adrenal gland. And I also had arthritis, severe arthritis throughout
So it's
my
hard
whole
for you to
body.
walk around?
It's hard for me to walk. To get out of bed, and so I was in a lot of pain with the side effects. But then, eventually they subside after not taking it anymore. But I also developed neuropathy on my feet. So that's something that I deal with on a daily basis.
And you're still dealing with that.
Yeah.
So with all the side effects of that drug, never mind chemo side effects, would you take it again if you were, if you heard that this could prolong
There's a
your
lot,
life?
absolutely. There's a lot of things out there, and one thing I did learn is that, this trial drug, it was part of the stage 2 of the drug, and I know that it's helped other patients, and it helps our research, and so that we will have a cure for metastatic breast cancer, triple negative, that we will have a cure. But all these drugs that are out there, they are trialed. They do have side effects. You are closely watched and monitored with the side effects. So, that's why eventually being on it for 4 months and with chemo at the same time, eventually we had to stop. But you know what? It's been 18 months now, and I have not had any treatment. And I go for scans every 3 months. So I believe...
So you only have to go in every 3 months
Every
now.
3 months, unless I feel something, which, I know my body now. If there's something I don't think is a little right, I will make sure I, go a lot sooner. But, yeah, I am blessed, and I do think that it did work. 18 months, when 2 years ago you were told you're going to be on chemo for the rest of your life. I didn't think I was going to see my son graduate from high school. He's graduating this year, and I'm looking for
yay.
college. So, yeah.
So the research is being done, the medicines that are being... People get scared, I think, and Dr. Caitlin Brown, you can answer this one. I've seen people set up for clinical trials for different kinds of biodrugs, and I think people are scared a lot of times, even if they are ill. Some people will say, I'll try anything because I want to live, but then some family members might say, well, what are the side effects? And wait, you're only in stage 2 of the trial, and it goes through 3 rounds before FDA approval, correct?
Right.
Okay. So Anne was in just the second round. So they had only done one other round of testing before Anne tried it. And so that's very brave to do that in the first place.
It is.
Where are we now is there anything getting closer in a drug form rather than chemotherapy, a drug form to either prolonging life or I know we're not stopping it yet because obviously you wouldn't still be doing the research, but are we making any progress on the drug front?
Yeah, so there are some FDA-approved immunotherapy drugs for non-small cell lung cancer and stuff.
But for breast cancer.
But for breast cancer, I'm not sure if there's anything specifically approved for breast cancer yet. It is very important that we have patients who are willing and able to go through these clinical trials because without them, we can't do the research to make sure that these drugs are available through brave patients like Anne, who allow us to make these strides and help even more people down the road to hopefully cure triple-negative breast cancer.
Okay, so research came out earlier this week that was published in the New England Journal of Medicine, and it was, I guess, out of a conference in I want to say in Europe, and I think it was in Munich, but they published the results in the New England Journal of Medicine that there is a specific they're saying immunotherapy drugs coupled with chemotherapy will, I forget the exact wording, but 20% to 40% folks will live longer. Right. Because triple negative, what is the typical lifespan, years of life left that they tell you when you get diagnosed with triple negative on average?
Yeah, so that depends on what stage your diagnosis is. So if you're a stage 1, that means the cancer hasn't spread to the lymph nodes yet. That's much better than a stage 4 where you have metastases to bone and brain. So it'll depend very much on the stage of diagnosis.
Okay, so what, when you're doing research just in layman's terms at UMass, in the lab, what is it, you said you're trying to stop it, but are we hoping that there's going to be more drugs down the road?
Yes, absolutely. We are definitely looking at new ways to target these metastatic cells. So right now it feels like you're playing whack-a-mole metastases because every time you try to target a cell, it figures out a way to evade it. So you're trying one thing, it figures out a way around that drug. So you're trying a new thing, and it figures out a way around that new thing too. So we're trying to figure out how to completely undermine these cells' ability to live in these metastatic sites. So we're trying to completely get rid of them. But right now it is a bit like whack-a-mole. You just have to keep trying new drugs and trying new drugs.
Okay. So my guests in studio today, I have Anne McCarron, who is a 2-time cancer survivor. You consider yourself 2-time because you were diagnosed and then it spread to your liver, so you were diagnosed twice. And you're still here with a positive attitude. And also with us is Dr. Caitlin Brown, who is a researcher at UMass Medical School, funded by the American Cancer Society, doing very important research on breast cancer and how it grows and spreads and why it spreads. So, Anne, again, you and I had talked before the show about how you get up in the morning and how this changed you, and you call it for the better.
Well, it's given me a gift to cherish every moment, to not take things for granted, to really enjoy life. I got married.
Congratulations.
I try and say I love you more often. So I'm living the moment, and I'm really cherishing every day I have.
And what about when people get down and say, or they ask you, how do you get up in the morning? How do you stay so positive? How do you keep going to work at WPI? How do you do
working at WPI has been phenomenal. I work in a great college. I have a great supervisor. My athletic director, Donna Harmon. They've all been supportive. So whatever I needed, I was there. Working was really important to me. There were times where I struggled just to walk into the building and sit in my office. And, I know some of my staff would say, Ian, why don't you just take a week off? And I didn't. Being there and working was really a good thing for me. I was fortunate I could go home and not move from the couch and didn't have to cook or do any laundry or anything for a good year and a half. But going to work, driving my son to school were really important things that helped me focus on life. And, so I'm grateful. I have a lot to be blessed.
That's an incredible way to look at it. You also said that a lot of people pitched in to help because, and I know American Cancer Society offers programs and such that Dr. Brown can talk about, because people always say, "How do I approach it? What do I say? I don't want to say the wrong thing. If I see someone who doesn't have hair, do I assume I don't know what kind of cancer they have? But how can people help a loved one or a friend that may be going through this? Do you step back? Do you come? I mean, how did you feel when people approached you?
The people always just checked in. How you doing? How you feeling? They often told me I looked great, which I knew was pretty funny because I did have a cap on and I didn't look great, but they always were trying to pick me up and be positive. I had friends that would send us meals every other week, so we had people that would deliver dinner to us, help Quinn out, that's my son, with rides. So I had so much support and again, we're so grateful. I was so grateful for that. People took me to my treatment. I never went alone. So, and if I did need a ride, I know that the American Cancer Society have rides to help you get there for your treatment. So, I mean, I was just, again, I can't say enough. I do have a friend, Joan, who makes me one of those shakes. For the last 2 years, I've had a shake every other day.
A nutritional.
A nutritional shake that, at first it was hard to drink, but now I get 2 a week, every other day, and I have to drink them. And so, yeah, I'm just so blessed to be here and that I had so many supports. But people coming up to you and talking to you and saying, how's it going, what's going on, and can I help? People want to help.
And you took that, it's okay. You weren't, you welcomed the...
Yeah, I needed it. There's no choice. You definitely couldn't do this alone. So, yeah, people work, and I also reached out to school where Quinn was to keep an eye on him, making sure he was okay.
So the school was very...
Yeah, supportive, yeah.
That's great. So, Caitlin, Dr. Brown, what other programs, I know just because you're involved with the American Cancer Society, I know they offer rides for people that may have issues. Is there anything else that they do? I'm sure there's a lot that they do, but especially for breast cancer.
So they provide rides to treatment, but they also provide lodging. So if your treatment is really far away, they can help you stay overnight. If you have to do multiple nights, they can help you out with that. They provide a lot of resources, information, as you have noted. They have a lot of information about statistics and guides to what these terms mean, because not everyone is aware of what triple-negative breast cancer means.
I was not, and it runs in my family. I know what metastatic means. I know it means it spreads, but triple-negative, I thought the same thing Ann did when Ann first told me, because I didn't hear that part of the story. I knew she had breast cancer, but I heard triple-negative. I'm thinking, negative, that's good.
Mm-hmm. Yeah,
I had the same exact reaction.
Normally when you get a test back and it's negative, that's a good thing. So triple-negative breast cancer is when you have a lack of receptors. So in a normal mammary tissue, breast tissue, there are hormone receptors because breast is a hormone-responsive tissue. Mm-hmm. So in most breast cancers, you have either the estrogen receptor, the progesterone receptor, or what's called a HER2/neu receptor.
So those are all hormones.
Hormone receptors.
We know estrogen. People know what progesterone is.
Right. And those all can be targeted for treatment. Those are pretty good targets for treatment. But if you don't have any of those receptors, then you don't have any targeted treatments, and you're left only with chemo and radiation. Or in the past you were. Now we have
drugs.
Now we have
we're making
drugs.
progress.
We're making progress.
And to hear people like Ann, like you said, people who are willing to jump into a trial before it's even in the third phase or approved by the FDA is the kind of people you need. So I mean,
brave patients to make that leap.
Now, when you talk about mammograms, and I still don't get this, and both of you can comment on this, but I'm going to say from my perspective, I'm turning 51 in 2 weeks. It's on election day, so for my birthday, everyone please vote. That's all I ask. But I did have it run in my family on the maternal side. I am from Eastern European genetics, so the BRCA gene, which became actually more of a household name when for better or for worse, Angelina Jolie came out and started really talking about that. And I know even when I've been sick with things, celebrities, when they come out, people do listen. So she really took everyone thought it was so daring to have a double mastectomy. And remember the whole thing about have a double mastectomy, why? That's too invasive. Why are you doing that to her? They were saying that to her. If you don't know that you have it, but it's in your genetics, or you might have it in one breast, why have both? Everyone was judging. But the point is that why are people so afraid to have a mammogram? And why did the age, I'm confused even, because it was 40 as a rule years ago, and now it's become 50 if you have no history. So,
Right.
and people think it's painful. Okay, so I don't understand, because it's not invasive, it's not a needle, it's not, any kind of shot. It's a machine.
Yeah, and
It's like
it
an
is,
X-ray,
Well, it's an inconvenience. It takes time out of your busy schedule. But if it can save your life, it's absolutely worth that half an hour, in the machine. It's definitely worth it.
So let's talk about causes, just so that people understand. And I don't know, Anne, we didn't talk about this. I don't know where you fall on this. But genetics can play a part.
Definitely.
Okay, so are we at the stage where I hear doctors, and I know you're not a practicing physician, surgeon of doing this, but is there any, we've talked about nutrition, right? And omega-3s, which is a fatty acid, like fish oil, that you hear about that a lot as helping, does it help prevent or help stop it from growing, like the nutritional aspect?
So the nutritional aspect, I think the data on it are absolutely, they're preliminary, and I would say definitely keep a balanced diet, keep your weights in check. That is always good to help prevent cancer. I don't know if they have an impact on progression and spread. I don't think the data are in on that. So just speaking from a purely scientific standpoint, I wouldn't want to leap to any conclusion saying if you take omega-3s, you're not going to have cancer, it's not going to spread.
Right. But they're saying nutrition and then obesity, though, we know that's been tested, correct?
That's been linked with a higher incidence of cancer.
And then what if someone knows that it runs in their family, they just maybe should start having mammograms early or talk to their primary care?
Yes. If you have a strong history, you can have a BRCA1 test done. If you have a strong family history, you can get screened for that mutation.
To see if you have the gene that could cause it.
If you have the gene, and if that does, then you can make the choice to have a double mastectomy. You can make some choices with your doctor about what to do next.
But as we wrap up, the age now is 50 with no history that you're supposed to start having mammograms? Is that what
Yes.
the scientific community is saying? Okay. And we're going to wrap up, so I'm going to leave this to you. I want you to, if somebody's listening out there and they're struggling or they have a family member that's struggling, what would you say from your experience?
There's hope. Don't worry. There's a lot of resources out there. Go to the American Cancer Society website. Do your homework. Have someone with you. I had someone take notes, and we did all the research before we made decisions on how I wanted to be treated. But just really learn. You'll learn more about breast cancer or cancer than you ever thought you would know. But educate yourself. Ask for help. Get the support that you need. You're not alone.
And go for that mammogram, because that's how you found out in the very beginning.
Absolutely. Early detection, prevention is key. Early detection. I did have my annual mammogram, and a week later they said we saw something. We went for ultrasound, and then we did the biopsy. And after the biopsy, that's when they can confirm and reassure that, yep, that's what I have.
And do you have
Right.
family history of it?
You know what? I have a grandmother that I never met because she died of breast cancer.
Oh.
70 years ago.
But you knew about
she-
that.
Yeah, so that was a long time ago when they didn't even know what breast cancer was. So.
Right. So in a positive way, we are making
strides.
We are making strides, and the American Cancer Society has been holding these making strides walks around the state and the country. They had one in Worcester to raise money for people like Dr. Brown so they can keep fighting against this disease and help us better understand it. And so funding needs to keep pace with that. So thanks for your work, Dr. Brown. I greatly
Thanks for
appreciate that.
supporting me.
Absolutely. And and Ann McCarran, people can't see you. And I just wish you could see the life in this woman. And when she's coming to tears, it's because she's passionate and she's living with this every day. And it makes, I just think it's really profoundly had an impact on me and how I think about life every day. So I want to thank you for that. And I want to thank you for being here and sharing your story and encouraging people so they know that it's possible to continue living on.
Thank you so much.
Thank you. So thank you for both being you. That's Community Conversations. I'm Vicki Green, and have a truly wonderful day.